Every single year, over 675,000 Americans die from complications related to high blood pressure, even though the vast majority of them take their medications religiously. I am Dr. Eric Lawson, and after spending more than 20 years opening chests as a cardiac surgeon, I have seen exactly why these daily pills are failing you. Before we dive in, please remember that this video is strictly for educational purposes and not intended to replace professional medical advice. For decades, you have been told a fundamental lie about your cardiovascular system. You have been told that high blood pressure is merely a plumbing issue. Your doctor says you have too much fluid volume, so you cut back on salt and take a diuretic to flush out the water. The numbers on your monitor go down and everyone assumes the problem is solved. But the problem is not solved at all. This entire framework is dangerously incomplete and based on outdated medical thinking from 50 years ago. It is keeping millions of people sick while giving them a false sense of security. High blood pressure is not a plumbing problem about the volume of the water. It is a structural problem about the pipes themselves. When I perform bypass surgery, I see this reality firsthand. A healthy artery has beautiful elasticity and springs back instantly when you make an incision, but a diseased artery from someone with chronic hypertension feels exactly like cutting into solid bone. They are severely stiff, rigid, and deteriorating at the cellular level. This rigidity is what hypertension actually is. Prescription medications simply manipulate the pressure readings on your monitor, but they do absolutely nothing to repair the underlying structural damage of your vessels. In this video, we are going to look beyond the basic numbers. You will discover the 4 hidden biological mechanisms that actually create this dangerous rigidity, and more importantly, the complete 4-step protocol to reverse this cellular damage naturally. It is time to take your health back into your own hands. Let us start by understanding what is actually happening inside your vessels. Your arteries are extraordinarily complex living structures composed of 3 distinct layers. The innermost surface that directly touches your blood is called the endothelium. It is a single layer of cells thinner than tissue paper. This layer is absolutely critical because it is a highly active metabolic organ that controls blood flow and maintains vessel health. The endothelium has a microscopic protective shield called the glycocalyx. I want you to think of the glycocalyx exactly like the non-stick coating on the interior surface of your arteries. This invisible coating is constructed from sugar molecules and proteins. According to cellular research, this non-stick coating performs several critical functions for your cardiovascular system. It creates a smooth, frictionless surface, allowing your blood to flow without any resistance. It acts as a security system, preventing inflammatory molecules from attaching to your artery walls. It also signals your vessels to release nitric oxide to keep them wide open and relaxed. When this coating remains intact, your vessels stay flexible, and your blood pressure remains perfectly normal. But here is where the disaster begins. Elevated blood sugar levels, chronic systemic inflammation, cigarette smoking, and oxidative stress strip away the glycocalyx, just like acid, dissolving a protective coating. Once that protective layer is gone, your vessel walls become completely exposed and vulnerable. Inflammatory molecules from your bloodstream attach to the surface. White blood cells adhere to the wall, and bad cholesterol easily penetrates into the tissue. Atherosclerotic plaque begins forming. Your arteries lose their flexibility, constrict, and your blood pressure climbs higher. This destruction of the glycocalyx is the very first hidden mechanism of hypertension. From an educational standpoint, this is exactly why the traditional medical approach is failing you. Absolutely no prescription blood pressure medication repairs the glycocalyx. ACE inhibitors do not fix it. Beta blockers do not rebuild it. Diuretics certainly do not heal it. They just force the pressure numbers down on your monitor while the underlying cellular damage remains completely untreated. You are still silently progressing toward a stroke or heart attack because the structural damage is still present. The medication treats the symptom but completely ignores the root cause. We must shift our perspective from simply managing monitor readings to actively rebuilding this cellular shield. This brings us directly to the second hidden mechanism of high blood pressure, which is arterial stiffness and severe calcification. From an educational perspective, it is concerning that most physicians overlook this physiological reality. They focus exclusively on blood pressure numbers displayed on monitors, but ignore whether the arteries are actually stiff or flexible. That critical distinction matters far more than the basic numbers. Research published in the Journal of the American College of Cardiology in 2010 demonstrated through a systematic review that arterial stiffness predicts cardiovascular events and overall mortality far better than traditional blood pressure measurements alone. Let us break down how you can spot this issue. Blood pressure is always measured as two numbers, which are your systolic pressure over your diastolic pressure. The mathematical difference between these two numbers is called your pulse pressure, and it gives you incredible educational insight into your arterial stiffness. A normal, healthy pulse pressure falls between 40 and 50. But as arteries stiffen with age and chronic disease, your systolic pressure increases while your diastolic pressure simultaneously decreases. You might end up with a reading of 162/72. In this scenario, the systolic is elevated and the diastolic is low, but the pulse pressure is a massive 90. Any wide pulse pressure, specifically anything over 65, is a red flag indicating that your arteries are becoming incredibly stiff and highly calcified. Your aorta has lost its natural elasticity and shock-absorbing capacity. A 2006 expert consensus document published in the European Heart Journal established that this dangerous arterial stiffness can be measured using a non-invasive test called pulse wave velocity. This test measures how rapidly a pressure wave travels through your arterial system. In flexible, healthy arteries, the wave travels relatively slowly, at about 6 to 7 meters per second. However, in heavily diseased arteries, the wave travels extremely rapidly at 12 to 15 meters per second. The faster the wave velocity, the stiffer your arteries are and the higher your cardiovascular risk becomes. This test is completely non-invasive and takes only 10 minutes to perform, yet almost no mainstream physicians ever order it. Why do they skip this vital diagnostic tool? Because there is currently no prescription medication that fixes arterial stiffness directly. To understand this structural failure, we must look at what causes this stiffness at the tissue level. Your artery wall consists of 3 layers, and the middle layer is called the tunica media. This layer is composed of smooth muscle cells and elastic fibers, which gives your arteries their unique flexibility to expand and contract with every heartbeat. But as you age, especially if you are battling chronic hypertension or systemic inflammation, 3 destructive biological processes ruin this middle layer. First, dangerous calcium deposits begin forming. Calcium strictly belongs in your skeletal system and never in your arterial walls. But when blood vessels are chronically inflamed, calcium migrates from your flowing bloodstream into the tunica media. It crystallizes, making the vessel wall progressively more rigid. Second, your precious elastic fibers physically break down and severely degrade. They are gradually replaced by thick collagen, which is exceptionally stiff and inflexible. Third, your smooth muscle cells undergo a bizarre pathological transformation. They stop functioning like normal muscle cells and mysteriously start behaving like bone-forming cells, actively depositing even more calcium. A comprehensive review published in the Journal of the American College of Cardiology in 2019 established that this specific process, called vascular calcification, is the primary driver of arterial stiffness. By the time a patient reaches 65 years old with poorly controlled hypertension, their arteries can literally resemble solid bone tissue much more than healthy blood vessels. They are calcified, rigid, and completely inflexible. And here is the harsh medical truth for your health education. Absolutely no blood pressure medication reverses this terrifying biological process. ACE inhibitors do nothing to remove calcium deposits from your walls. Calcium channel blockers might stop new calcium from entering cells to help them temporarily relax, but they fail to remove the heavy calcium already embedded in your structural wall. The dangerous calcification remains, and the deadly stiffness persists untreated. We are left managing surface symptoms, while the foundation completely crumbles. Before we move on to the third mechanism, I really want to hear from you. Have you ever had a doctor calculate your pulse pressure or discuss arterial calcification with you? Please leave a comment down below this video right now and share your personal experience so we can all learn together. Let us transition from the physical stiffness of your arteries to the third hidden mechanism, which is a catastrophic failure in chemical signaling, specifically a severe deficiency in nitric oxide. From an educational viewpoint, this is a fascinating area where conventional medicine completely misses the mark. Most doctors view blood pressure as a purely mechanical pump issue, but your cardiovascular system is actually driven by brilliant microscopic chemistry. Research published in the European Heart Journal in 2012 established that nitric oxide is arguably the most important signaling molecule in your entire circulatory system. It is a powerful gas produced directly by your endothelial cells. When released, it travels into the smooth muscle layer of your artery wall and acts as a master key instructing those tight muscles to relax and dilate. When your blood vessels open up, vascular resistance instantly drops and your blood pressure naturally normalizes. A healthy, undamaged endothelium produces a continuous stream of nitric oxide, keeping your vessels beautifully relaxed. However, when your protective glycocalyx is destroyed by inflammation or elevated blood sugar, your nitric oxide production plummets. Your arteries become biochemically incapable of relaxing, so they remain clamped shut, and your blood pressure surges. The specific factory that manufactures this gas is an enzyme called endothelial nitric oxide synthase, or simply eNOS. For this cellular factory to operate properly, it requires a vital helper molecule called tetrahydrobiopterin. When you have abundant levels of this helper molecule, your eNOS enzyme smoothly produces healthy nitric oxide. But here is the critical educational insight that changes everything. When poor diet and oxidative stress deplete your helper molecules, your eNOS factory actually breaks down. Instead of producing life-saving nitric oxide, it wildly misfires and starts pumping out dangerous free radicals that cause massive oxidative damage to your vessels. The very enzyme designed to heal you begins actively destroying your arteries from the inside out. Once again, standard pharmaceutical pills completely fail to fix this broken enzyme factory. They try to artificially force the blood vessels open while leaving your natural cellular machinery completely disabled. We must shift our focus to repairing this cellular factory, restoring its helper molecules, and naturally boosting your nitric oxide production. This brings us directly to the fourth and final mechanism, which is entirely controlled by a hormone you likely never associated with blood pressure. We must talk about the profound connection between your kidneys and insulin. From an educational standpoint, this biological mechanism explains why simply reducing your daily salt intake fails for the vast majority of patients. Your kidneys are designed to control your blood pressure by regulating your internal sodium balance. However, this delicate physiological system depends entirely on your kidneys being able to properly excrete excess sodium into your urine. Here is the massive medical blind spot that most doctors miss. Chronically elevated insulin physically blocks your kidneys from excreting that sodium. When your insulin levels are high, your kidneys are locked in a continuous retention mode. They will fiercely hold on to sodium regardless of how little salt you actually consume. Research published in the New England Journal of Medicine in 1987 established beyond any doubt that insulin resistance plays a direct causal role in blood pressure elevation. Insulin acts as a harsh taskmaster on your kidneys through several destructive pathways. First, it directly forces the proximal tubule of your nephron to reabsorb sodium right back into your flowing bloodstream. Second, it triggers a dangerous hormonal cascade that releases aldosterone, which further commands your body to hoard sodium and violently flush out precious potassium. Third, a landmark 1991 paper in Diabetes Care proved that elevated insulin makes your blood vessels extremely hypersensitive to powerful vasoconstrictors. The most dangerous educational reality here is that you can have severe insulin resistance without ever having clinical diabetes. Your fasting blood glucose might look perfectly normal. Your routine hemoglobin lab results might be completely flawless. But underneath the surface, your insulin levels are chronically surging and driving your hypertension entirely silently. Traditional physicians rarely ever check fasting insulin levels. They usually only check basic glucose, and if that number is normal, they falsely assume your metabolism is fine. They are completely missing the exact metabolic trigger that is locking your kidneys and spiking your pressure. Understanding this deep metabolic connection is the final key to your cardiovascular education before we begin the actual reversal protocol. Before I reveal the complete 4-step reversal protocol that targets these exact metabolic mechanisms, please take a quick second to like this video and subscribe to the channel so you never miss this critical medical education. Now let us safely transition from understanding the biological problem to actively fixing it. The very first step of our protocol is fully restoring your glycocalyx. First, you must immediately stop destroying it. The primary destroyer of this microscopic protective coating is elevated blood sugar. Every single time your post-meal blood sugar spikes above 140, it literally damages the glycocalyx through a highly destructive process called glycation. You must stabilize your daily glucose levels by significantly reducing refined carbohydrates. Choose whole foods and non-starchy vegetables while strictly avoiding white sugar and processed grains. Second, you must provide your body with the exact molecular building blocks required to reconstruct this vital microscopic shield. The glycocalyx is fundamentally built from long chains of sulfated sugar molecules. The absolute best natural dietary source for this is a powerful compound called fucoidan extracted directly from brown seaweed. Clinical studies demonstrate that fucoidan supplements at daily doses of 600 to 1,000 milligrams actively restore glycocalyx thickness and dramatically improve overall endothelial function. Third, you constantly need to defend this newly built shield by significantly reducing oxidative stress in your bloodstream. You achieve this by flooding your biological system with potent antioxidants called polyphenols found abundantly in dark leafy greens, colorful berries, and green tea. These specific compounds actively neutralize dangerous free radicals before they can ever damage your delicate artery walls. To truly understand the educational power of this nutritional intervention, picture a real-world 71-year-old patient who suffered from chronic hypertension for 13 long years. Despite taking 2 prescription medications, they still demonstrated massive endothelial dysfunction on clinical lab tests. By simply eliminating refined carbohydrates, adding 800 milligrams of daily fucoidan, and consuming polyphenol-rich berries, their vascular health absolutely transformed. After 12 weeks, their endothelial dilation improved remarkably from 5% up to 13%. Within 6 months, their blood pressure dropped from 130/82 down to 116/74. By working collaboratively with their physician, they successfully transitioned off both medications entirely. This is the incredible power of true cellular healing. Now that we have successfully rebuilt your protective shield, we must address the structural rigidity we discussed earlier. This brings us to step 2 of our educational protocol, which is the active decalcification of your arterial walls. Many physicians falsely assume that once calcium deposits form inside your arteries, the damage is entirely irreversible. From a physiological standpoint, they are completely mistaken. Your body has a built-in mechanism to reverse this exact problem, but it requires a specific key. The hero of this biological process is a molecule called matrix GLA protein, or MGP. Think of this protein as a highly skilled traffic controller specifically designed for calcium. When properly activated, it strictly directs calcium away from your vulnerable arteries and forces it directly into your bones where it actually belongs. But when this controller is asleep, calcium wanders into your vascular tissue and solidifies. The only way to awaken and activate this traffic controller is through vitamin K2, specifically the MK7 form. Research published in the journal Atherosclerosis in 2009 proved that high dietary intake of this specific vitamin significantly reduces coronary calcification. The Rotterdam study, published in 2004, also confirmed it drastically reduces your overall risk of coronary heart disease. Clinical studies demonstrating these vascular benefits typically use daily doses between 180 and 360 micrograms. However, you must combine vitamin K2 with vitamin D because vitamin D is required to effectively absorb the calcium from your digestive tract and incorporate it into your bone matrix. They must work together as a synchronized team. The final indispensable component of this decalcification step is magnesium. In educational terms, magnesium acts as the ultimate natural calcium channel blocker. When your magnesium levels are optimized, it physically blocks excess calcium from inappropriately flooding into your smooth muscle cells. It also actively prevents existing calcium from crystallizing and forming those rigid deposits. Sadly, most adults are severely deficient in magnesium due to chronic stress and long-term use of diuretic medications. For cardiovascular repair, look for highly absorbable forms like magnesium glycinate at doses of 400 to 600 milligrams daily. To visualize the profound clinical impact, consider a 74-year-old patient who suffered from severe hypertension for 18 years. They were taking 4 different prescription medications, yet a CT scan revealed massive dangerous calcification throughout their aorta. By implementing this exact decalcification protocol with vitamin K2, vitamin D, and magnesium, their results were absolutely astonishing. After just 6 months, their measured calcification score decreased by 9%, allowing them to safely eliminate 1 prescription. After 1 full year, their rigid calcium deposits decreased by 16%. This proves that with proper education, your arteries absolutely can heal. Once your arteries begin softening and decalcifying, we must immediately jumpstart your cellular engine. This brings us directly to step 3 of our protocol, which is fully restoring your vital nitric oxide production. From an educational perspective, you cannot simply force your vessels to open up if the internal chemistry remains completely broken. We must protect your enos enzyme factory by boosting its crucial helper molecule called BH4. To achieve this naturally, you must flood your system with folate, vitamin C, and vitamin E. These specific nutrients actively regenerate BH4, preventing your cellular engines from malfunctioning and creating dangerous oxidative stress. You can easily source folate from dark leafy greens, vitamin C from berries and bell peppers, and vitamin E from seeds. A 1999 study published in the Journal of Cardiovascular Pharmacology proved that oral vitamin C physically reduces arterial stiffness. However, nutrition is only half of the biological equation. You must actively stimulate this enzyme through mechanical friction known as shear stress. The most clinically proven method is isometric hand grip training. Simply squeeze a hand grip device at 30% of your maximum strength for 2 minutes, rest for 1 minute, and repeat this 4 times. Doing this exactly 4 days a week produces incredible clinical results. Finally, you must consciously practice nasal breathing. Breathing through your nose instead of your mouth increases blood nitric oxide levels by up to 400% because your nasal passages actually function as natural gas-producing factories. Now that your vessels are chemically equipped to relax, we must address the root cause of your sodium retention. This brings us directly to the 4th and final step of our protocol, which is the complete insulin reset. From an educational perspective, you must understand that as long as your insulin remains elevated, your kidneys will relentlessly hoard sodium. We have to unlock your kidneys, and the most scientifically proven method to achieve this is through time-restricted eating. This means you simply condense all your daily food intake into a specific 8-hour window and fast for the remaining 16 hours. During the fasting window, you consume strictly 0 calories, drinking only water, black coffee, or plain tea. Clinical research clearly demonstrates that this specific eating schedule consistently lowers systolic blood pressure by 9 to 11 points within just 8 weeks. It achieves this without changing what you eat, but simply changing when you eat. When your fasting insulin drops, your kidneys are chemically unlocked, and they begin flushing out the trapped sodium. To accelerate this biological healing, you must also incorporate resistance training into your weekly routine. When you actively build muscle tissue, you develop millions of new insulin receptors. Clinical studies prove that resistance training 2 to 3 times per week reduces fasting insulin levels by 20 to 30% in 12 weeks. This is how you permanently fix the internal metabolic machinery instead of temporarily masking the symptoms. This brings us to the ultimate educational conclusion of our medical journey together. We have completely dismantled the outdated plumbing myth of high blood pressure and revealed the absolute truth about your cardiovascular health. You are facing a structural failure at the cellular level. But genuine reversal is entirely possible when you stop managing symptoms and start fixing the root causes. Let us summarize your complete cellular repair protocol. Step 1 is restoring your microscopic glycocalyx shield by controlling blood sugar and consuming sulfated polysaccharides with powerful antioxidants. Step 2 is active arterial decalcification using vitamin K2, vitamin D, and magnesium to pull dangerous calcium out of your vessel walls and safely back into your bones. Step 3 is restoring your nitric oxide production by regenerating your enos enzyme with targeted vitamins and stimulating it mechanically through isometric hand grip training and continuous nasal breathing. Step 4 is the complete insulin reset, unlocking your kidneys to naturally excrete trapped sodium through daily time-restricted eating and consistent resistance training. Now I must give you the most important medical advice of this entire video. I am absolutely not telling you to stop your prescription medication abruptly, because doing that would be incredibly dangerous. Prescription pills are a temporary bridge. They safely manage your surface symptoms while you implement this structural repair protocol. You must do both initially. Start integrating these 4 steps into your life while strictly continuing your current prescribed medications. Over the coming weeks, monitor your blood pressure daily at home and track your internal healing. As your cellular structures repair themselves, your numbers will naturally drop. When your readings consistently improve, you must work collaboratively with your personal physician to gradually reduce your dosages under professional supervision. Never stop your medication suddenly on your own. Conventional medicine wants you to believe that hypertension is a permanent life sentence. They only know how to artificially manage your monitor readings. But today you have acquired vital medical education. You possess the exact biochemical blueprint to rebuild your damaged arteries from the inside out. Do not become another tragic statistic among the hundreds of thousands of Americans who pass away from cardiovascular complications every year. You have the ultimate power to heal your body. Please choose true cellular reversal over lifelong symptom management. If you found this medical education valuable, please hit the like button right now and leave a comment below sharing which step you will implement first. Finally, please subscribe to the channel so you never miss out on life-saving insights. I am deeply committed to sharing my surgical knowledge to keep you safely out of my operating room. Please take incredible care of your vessels because they are the only ones you will ever have.